So how did we go from a world where a medical procedure meant spending an entire week recovering in a hospital bed to, getting a structural anatomical modification on your lunch break
Right.
in like 15 minutes?
Right. Yeah. It is a massive paradigm shift. You surrender your time and your body completely differently now. I mean, medicine has moved from being this monumental, slow-moving event to something that looks a lot more like a quick pit stop.
Definitely. Well, welcome to today's deep dive, everyone. We are exploring a really fascinating, rapidly booming, and honestly, often completely misunderstood industry.
Yeah, and you, our listener, have provided us with a truly massive stack of sources to navigate this. It's quite the collection.
It really is. I mean, we're looking at everything from the strictest medical guidelines from bodies like ACOG and the RACGP to highly granular clinical abstracts on hospital surgical efficiency, all the way to like these glossy, high-end aesthetic clinic brochures from London, Dubai, and Turkey.
It's a remarkably comprehensive stack you've shared. We're essentially jumping between peer-reviewed hospital data and slick marketing copy, which, gives us a really complete view of this landscape.
Exactly. And our ultimate mission for this deep dive is to cut through all of that marketing hype. We want to answer your core curiosity, what actually happens in the room during intimate wellness procedures like the G-shot.
Right.
And how on earth can a medical procedure be physically completed while you're on a quick break from work? But to understand how a cosmetic genital injection can take less time than drinking a coffee, we first have to look at the whole medical field.
Yeah, because the 15-minute cosmetic procedure didn't just appear out of nowhere in a vacuum.
No, not at all.
It's standing on the shoulders of decades of systemic hospital reform. I mean, if we look at the 2019 conference abstracts you provided from the British Association of Day Surgery, you can see this intense, almost obsessive focus on time-saving pathways.
The numbers in that abstract really stand out. They ran a study tracking the difference in time it took for patients to undergo operations. Things like laparoscopic hysterectomies, gallbladder removals, hernia repairs.
Right. Major surgeries.
Yeah. But they tracked patients using traditional hospital pathways versus dedicated day surgery unit, or DSU, pathways. And the kicker is they completely excluded the actual surgical time.
Wait, they just tracked the logistics?
Exactly. They just tracked the logistics.
That is fascinating. They were looking purely at the bureaucratic friction of moving a human body through a hospital. Waiting for a porter, transferring between wards.
Word out redundant paperwork.
Right, waiting for discharge sign-offs.
Yeah.
And by using a dedicated DSU pathway for just 9 patients, they saved a combined total of 5 hours and 19 minutes of direct clinical care time.
Nearly 6 hours saved on just 9 people. You scale that up to a national healthcare system, and you are talking about completely transforming hospital economics.
Oh, absolutely. The researchers explicitly conclude that this increased turnover allows more patients to be managed on an individual list, resulting in major financial savings for the hospital trust.
Efficiency becomes the paramount virtue, right?
Exactly. Efficiency is the virtue of modern medicine. But there is a hidden cost to this hyper-efficiency that we really have to talk about.
Right, because we're getting patients out the door faster. But what actually happens when they get home? I was reading the home recovering study you included from the Surgical Association, ASECMA.
Oh, yeah. That one is telling.
Right. They tracked patients recovering from these supposedly breezy day surgeries. The clinics are telling these patients, to expect to be active and back to normal in about 3 days.
But the reality on the couch was quite different. The study found that patients who were told they'd be active in 3 days actually took up to 6 days to recover.
Wow.
And for those with more physical jobs who were quoted 7 days, it took 10. They struggled with unmanaged pain, severe fatigue, and they ended up relying heavily on telephone support from nurses just to cope.
Just to cope with the sheer anxiety of managing their own recovery. So, if we're speeding up surgery and discharging patients immediately to save hospital resources, aren't we just outsourcing the most difficult part of recovery to the patient?
Yeah.
It feels like the drive-thruification of medicine.
That's a great way to put it. It is a massive transfer of the care burden from the institution to the individual. But, from a market perspective, this normalization of walking in and out of a clinic on the same day completely paved the way for the aesthetic clinic industry.
Oh, they saw an opportunity.
Exactly. Aesthetic medicine looked at that day surgery model and realized that speed is a highly marketable product. They thought, well, if hospitals promise low downtime, what if we promise zero downtime?
Right. And if the public now fully expects fast outpatient results, It makes perfect sense that an entire industry has exploded around intimate wellness or female genital cosmetic surgery.
Yeah, it does.
But reading through your sources, the medical establishment views this completely differently than the aesthetic clinics do.
Oh, it is a profound disconnect. Let's look at the strict warnings from the top medical authorities in your stack. You have the American College of Obstetricians and Gynecologists, ACOG, and the Royal Australian and New Zealand College, RANZIS-COG.
Right, the heavy hitters.
Exactly. They are incredibly clear, stating explicitly that terms like vaginal rejuvenation, G-spot amplification, and revirgination have zero clinical or scientific origin.
Wait, so they aren't even real medical terms?
No, not at all. They are entirely fabricated.
That is wild.
They are purely marketing phrases. ACOG emphasizes that there is a severe lack of high-quality data supporting the effectiveness of these procedures.
Right.
The safety simply hasn't been established for interventions meant to alter sexual appearance or function unless, it's treating a strictly diagnosed medical dysfunction or something like a prolapse.
The RACGP guidelines in Australia even advise general practitioners to actively pump the brakes and explore why a patient is requesting this surgery in the first place.
Yeah, they want doctors to screen for body dysmorphic disorder.
Exactly. They're asking GPs to look into outside influences. Like, is the patient feeling pressured by a partner's criticism? Or, and I found this really fascinating, are they influenced by fashion trends like Brazilian waxing?
The waxing trend is a huge factor.
Because if you remove all the hair, suddenly normal anatomy is highly visible and subject to intense unnatural scrutiny.
Right. That psychological screening is crucial because the medical bodies are operating from a place of treating pathology. They are looking for a disease to cure.
Makes sense.
But then you flip to the clinic brochures from Dubai, London, and Turkey that you provided. These clinics are marketing these exact same procedures using those exact non-medical terms as routine, empowering wellness treatments.
They sell them as solutions to alleviate physical discomfort, cure urinary incontinence, and massively boost self-esteem. But I have to stop you there because how does that work legally?
What do you mean?
Well, if the highest medical authorities in the world say these aren't real medical terms and there's limited data on risks, how can clinics globally use these exact phrases to sell you a physical procedure?
It works because they are operating in a regulatory gray area by selling an outcome rather than a strict medical cure.
Ah.
Traditional medicine diagnoses a disease. Aesthetic clinics are diagnosing a lack of confidence or desire for enhanced pleasure and offering a structural modification to achieve that feeling.
Right, it's consumerism meeting medicine.
Exactly.
Yeah.
Because it is elective and the patient is fully consenting to a cosmetic enhancement, the clinics can use consumer-friendly language rather than strict anatomical nomenclature.
Which brings us directly to the primary focus of your deep dive and
Yeah.
really the core of your curiosity, the G-shot or G-spot amplification. If it is technically a marketing term, what is actually happening biologically in that room?
Right.
Because they market this as a lunch break fix, I'm assuming there's no scalpel involved.
Let's break down the mechanics of the G-shot appointment step by step, focusing heavily on the timeline because that is the most revealing part.
Yeah, let's get into the timing.
The entire appointment, from walking into the treatment room to walking out the door, takes approximately 15 to 30 minutes in total.
Okay, so a true lunch break procedure. Walk us through how you fit a structural modification into 15 to 30 minutes.
So first, the patient is positioned similarly to how they would be for a routine cervical smear test. Then comes a highly unique collaborative step. The patient is actually asked to self-examine to help the doctor physically locate their Grafenberg spot.
Which, according to the literature, is located on the front wall inside the vaginal canal and is connected to the deeper clitoral network. But why do they need the patient to find it? Doesn't the doctor know anatomy?
They know the general region, sure, but anatomical maps aren't perfectly universal. The exact location, size, and sensitivity of this zone can vary wildly from person to person.
Oh, I see.
So patient guidance is absolutely required for precision. Once the target is definitively agreed upon, the doctor uses a special speculum to expose that specific area. Then, a local anesthetic, typically lidocaine, is applied to completely numb the tissue.
And once the tissue is numb, the amplification part begins. Are they just inflating the tissue? What exactly is in the needle?
They are injecting a hyaluronic, acid-based dermal filler. If you're familiar with facial aesthetics, this is the exact same substance products like Juvederm or Restylane that clinics use for plumping lips or filling in under-eye tear troughs.
But how does hyaluronic acid physically amplify anything?
Hyaluronic acid is a naturally occurring sugar molecule in the human body, which makes the risk of an allergic reaction incredibly low.
Okay.
Its primary mechanical function is to bind to water. It acts like a sponge, holding onto moisture to create thick, gel-like volume.
So they're taking a water-binding facial filler and injecting it internally. What is the structural goal of adding that volume?
The goal is simply to increase the size and thickness of the G-spot, projecting it lower into the vaginal canal. The literature from the London clinics notes that they aim to augment the zone to about the size of a UK 5p coin.
A 5p coin.
Yeah. By making it physically larger and more prominent, the mechanical theory is that it creates more friction and makes it much easier to stimulate during penetrative sex.
Okay, here is the detail that completely stopped me in my tracks when reading your sources.
Right.
The duration of the actual injection. We established that the whole appointment is 15 to 30 minutes.
Right.
But according to the clinic breakdowns, the actual injection duration, like the time the needle is actively working to place that filler, takes no more than 5 to 10 minutes.
That's the reality of the procedure. The vast majority of that 30-minute window is the consultation, the positioning, the collaborative self-examination to locate the target, and waiting a few minutes for the lidocaine to properly numb the area.
Wow.
The physical intervention itself is remarkably brief, just 5 to 10 minutes of active injection time.
So to simplify this entire concept for you, it is essentially a lip filler procedure. But the filler is placed in a highly debated internal erogenous zone, aiming to increase the target size to a 5p coin for exactly 5 to 10 minutes of clinical work.
That is definitely the most accurate way to frame it. It is a quick, temporary plumping. Yeah, because it is hyaluronic acid, your body will naturally metabolize it and break it down over time. The enhanced sensitivity results typically last 4 to 6 months. Some clinics will claim it can last up to 9 or 12 months, but that heavily depends on how fast your individual metabolism burns through the filler.
And what does the recovery look like for a 5-minute injection?
You can literally return to work immediately. The only strict post-procedure rule is that you must avoid sexual activity for 5 to 7 days. That allows the injection points to fully heal and prevents any risk of infection.
Contrast that 15-minute appointment and 5-minute injection with the surgical vaginoplasty, which is also in your stack. I mean, it is night and day.
Oh, it's an entirely different universe of medicine. A vaginoplasty is not a quick plumping. It is deep architectural reconstruction.
Right.
Dr. Burak's clinic in Turkey outlines this well. A vaginoplasty, specifically a procedure called a posterior colporrhaphy.
Okay, pause. Translate posterior colporrhaphy for those of us without a surgical background.
Right, sorry. It essentially means repairing the back wall of the vagina. It requires the surgeon to make deep incisions along the vaginal wall to identify the levator ani muscles.
Ouch. Okay.
Those are the main sling muscles that support your entire pelvic floor. If they have separated, perhaps due to childbirth, the surgeon physically sutures them back together to rebuild the structural integrity of the pelvis.
So they are literally sewing muscles back together.
Yes, and it requires total intravenous anesthesia, or TIVA. It takes 1 to 2 hours of active surgical time, and it demands a full 6 weeks of painful recovery before you can even think about resuming normal physical activities.
So the G-shot is clearly the absolute pinnacle of the fast, non-invasive fix. But it relies on synthetic filler. Your sources show there are other lunch break tools in this cosmetic toolkit that rely on your own biology or even energy devices rather than hyaluronic acid.
Exactly. The G-shot is most often contrasted with the O-shot.
Right, the O-shot.
The O-shot is aimed at the exact same goal-enhancing arousal and sensitivity, but the mechanism and the timeline are different. An O-shot appointment takes longer, generally about 60 minutes in total.
Wait, if they aren't doing deep surgery, why does it take an hour?
Because it requires a blood draw and processing time. The O-shot relies on platelet-rich plasma, or PRP. They draw your blood exactly like a standard blood test at your GP. Then they place that vial into a specialized centrifuge machine.
How does the centrifuge actually turn normal blood into what the clinics call liquid gold?
Well, it uses rapid centrifugal force to separate the blood based on density. As it spins at incredibly high speeds for about 15 minutes, the heavier red blood cells are pushed to the absolute bottom of the vial.
Okay.
What is left floating on top is a concentrated yellowish serum packed with platelets and growth factors.
And then they just inject that yellow serum back in.
Exactly. That PRP is injected into the clitoris and the anterior vaginal wall. The biological mechanism here isn't just to add temporary volume like a filler.
Right. It's different.
The growth factors act as biological signals. They tell your body's local stem cells to wake up and start promoting the growth of new blood vessels and actively regenerating the tissue over the course of several weeks.
So the active injection time is still incredibly brief, only about 5 to 10 minutes, but the biological processing time stretches the appointment to an hour.
Precisely.
And if you are terrified of needles entirely, there are lasers.
Yes, devices like the Photona Smooth Laser. These use specific light wavelengths known as RRA and NDAAG.
What do those letters actually mean in terms of what the light does to the tissue?
It basically dictates how deep the light penetrates. These wavelengths deliver highly controlled thermal energy or heat deep into the vaginal tissues without burning the surface.
Okay, so it heats it from the inside.
Right. This controlled heat causes micro-injuries beneath the surface, which triggers the body's natural healing response. It stimulates the production of brand new collagen and elastin, tightening the tissue and improving blood flow.
And how long does that take?
A laser session takes about 15 to 30 minutes, requires absolutely no anesthesia, and has zero downtime.
Wow. Okay, so we are talking about highly concentrated blood plasma and microdoses of dermal fillers being injected into incredibly sensitive microscopic tissue during a rushed 5 to 10 minute injection window.
Yeah.
And this context makes a study in your stack absolutely fascinating to me. It's about something called infusion dead space.
The ICU study, yes. Bringing this data into the aesthetic conversation is a brilliant connection to make.
Let me paint a picture of this study for you. In a highly controlled intensive care unit, researchers studied standard IV administration sets, the plastic tubing used to deliver critical life-saving drugs.
Right.
They found that the dead space inside that mechanical plastic tubing trapped an average of 18 milliliters of fluid.
And 18 milliliters might not sound like a huge amount at first glance.
Are you kidding?
Yeah.
18 milliliters is almost 4 full teaspoons of liquid just hanging out in the tube.
Yeah, it is a lot. When you look at the percentages, the scale of the problem becomes clear. The study surveyed nurses and found a huge majority were not flushing the IV lines after administering the drugs.
Wow.
Because of that dead space, patients were missing massive amounts of their prescribed medication. In fact, 67% of the time, patients were missing 18% of their IV metronidazole dose, which is a crucial antibiotic. They missed 18% of their paracetamol.
In a life-or-death ICU setting, the mere mechanical reality of plastic tubing means patients lose nearly a fifth of their vital medication. So I have to ask,
Yeah.
if a highly controlled ICU setting loses 18% of a drug in a simple IV tube, how precisely can we trust these cosmetic injections of filler and blood plasma? I mean, when a practitioner is injecting a target the size of a 5p coin in exactly 5 minutes, doesn't the sheer mechanics of a plastic syringe make that highly inaccurate?
That is an incredibly sharp observation, and it cuts right to the heart of a massive debate currently raging in the medical community. Medicine is inherently messy, and mechanical precision matters immensely. This exact concern regarding the safety, mechanical precision, and rigorous training required for high-risk injections is why the UK's Medicines and Healthcare Products Regulatory Agency, the MHRA, is actively stepping in.
So they're realizing that you need more than just consumer-friendly marketing to safely wield a needle.
Definitely. The MHRA is consulting on heavily restricting who can legally inject these substances. Their consultation document specifically flags the injection of dermal fillers into the genitals and the use of PRP as high-risk procedures.
That makes total sense.
They are considering restricting these strictly to qualified, regulated healthcare professionals because when you are rushing a 5-minute injection into a microscopic target, the margin for error is razor thin.
Clearly, injecting substances for rapid relief or enhancement is a foundational modern medical tool. And looking globally through your sources, we see that relying on fast, non-invasive technology isn't just an aesthetic trend.
No, it's deeply embedded in foundational health worldwide. The concept of the quick injection or the quick energy intervention exists across all medical disciplines now. Well, look at the NHS Southwest London guidelines you provided. They detail how localized steroid injections are used routinely for severe spinal and bursal pain. Just like the G-shot, the goal is to use a fast, targeted injection to alter the physical state, in the NHS's case, breaking the biological cycle of inflammation and pain to allow the patient to actually engage in physical therapy.
Oh, I see. We see it internationally too, right? The SH Clinic in South Korea relies on high-intensity focused ultrasound, or HIFU. They use concentrated sound waves to treat uterine conditions like adenomyosis.
Hold on. For clarity, what is adenomyosis?
It's a painful condition where the tissue that normally lines the inside of the uterus actually starts growing into the muscular wall of the uterus itself.
Ouch!
Yeah, and instead of surgical removal, they use rapid, non-invasive sound waves to treat it.
Amazing. But here is the massive catch hiding in your sources. While we have engineered all these incredibly fast 15-minute interventions, the guidelines also reveal that some of the most effective foundational treatments require a completely different, almost forgotten kind of time commitment.
You're talking about the Central and Northwest London, the CNWL Sexual Health Services Guidelines.
Yeah.
They point out a totally free, completely non-invasive alternative to dramatically improve pelvic strength and intimate wellness, Kegel exercises.
The ultimate unglamorous foundational health practice.
Right. But look at the dosage they prescribe. To actually feel a physiological difference, they recommend doing up to 50 short and long muscular contractions every single day.
Every single day.
And you won't notice the results until you have done that consistently for a month to 6 weeks.
And right there is the core cultural tension of this entire deep dive.
Is the massive popularity of a 1,200-pound, 15-minute G-shot simply a reflection of the fact that none of us want to do 50 Kegel exercises a day for a month?
If we look at human behavior, I think the data points to yes.
Yeah.
We live in an era that overwhelmingly values the immediate intervention over slow foundational maintenance. The 15-minute fix, whether it's an outpatient honey repair, a quick laser session, or a 5-minute injection of hyaluronic acid, fits perfectly into the fast-paced reality of modern life.
So true.
Foundational maintenance of the body requires discipline and time, two things we feel we simply do not have.
Let's summarize the wild journey we've been on today. We started by looking at the incredible time-saving efficiencies of hospital day surgeries, which, for better or worse, trained us to expect medical care to be fast.
We then navigated the stark divide between strict medical terminology, where doctors are screening for dysmorphia, and the outcome-driven, confidence-selling marketing of aesthetic clinics.
And we answered your biggest question, exactly what happens and how fast it happens during a G-shot.
We broke down the 15 to 30-minute appointment, highlighting that the active injection time is a mere 5 to 10 minutes.
We explored how hyaluronic acid physically binds water to create a temporary 5p-sized structural change. We contracted that 5-minute precision with the startling realities of medical dead space and ICU tubing.
And we weighed the powerful allure of the 15-minute fix against the hard, unglamorous work of foundational health.
Which leaves us with a final fascinating thought to consider before we wrap up.
Yeah, as these regenerative treatments, like spinning your own blood in a centrifuge for a PRP injection, become even faster, cheaper, and more culturally normalized, will the line between a cosmetic shot and preventative healthcare blur completely.
Oh, wow.
Imagine a world in the near future where taking 15 minutes on your lunch break to inject your own concentrated stem cells isn't seen as an elective aesthetic luxury for intimate wellness.
Right.
Imagine if it becomes a mandatory routine requirement, just like going to the dentist, to permanently stave off the aging of all your internal organs.
That is an incredible thought to leave you with. If the slow, week-long hospital stay was the old paradigm of medicine, the 5-minute lunch break stem cell injection is absolutely the new frontier. Thank you so much for exploring this deep dive with us. Keep questioning the marketing, keep digging into the mechanics of how things actually work, and we will catch you on the next one.